I'm going to get report from my night shifters. She's going to tell me, what's her name? Mrs. Hayes, Linda, she likes to be called Linda, has been needing to be suctioned probably about a couple times a shift in the 12 hours. So she's doing pretty good. She has the passing mirror valve that she can communicate with. But right now it's not in because she's been really quiet and comfortable for the night and stuff. The other thing she has told me that she likes us when we go in to make sure that her head of the bed is elevated all the way up because it's more comfortable for her. So next thing I'm gonna do, check my chart and everything. I'm gonna get ready to go in to see Mrs. Hayes, Linda. So I'm gonna go ahead and gather my supplies that I'm gonna need. Trach care needs to be done once a shift, so I'm gonna be going in to do the trach care after I suction her. So I wanna suction everything out first before I start in doing trach care. If I don't, then it's all gonna be getting the dressing dirty and everything else. So I have 2 trach care sets, I'm gonna have 2 suction sets, and 2 pair of gloves, okay? In the trach kit and stuff, it will tell you, you can always look to see, we'll always wanna check to see what's in my trach in these kits. Every hospital has different kits, and it might not have everything in here that I need. So I'm gonna read over everything and see what's in here. And it's telling me I have everything that I will need to do hers, trach care, okay? This one will tell me that I have a 12-French suction catheter in here, and also that I'm gonna have a little pop-up cup, and I'm gonna have gloves. So I've got everything that I need. So I'm gonna go ahead and knock on the door. I'm gonna wash my hands, introduce myself to Linda. I'm gonna be checking her ID and everything. I'm gonna give her passive mirror valve so she can put that in herself, because Linda is getting ready to be discharged before long. So she clips that on and she tells me her name and date of birth. I'm gonna say, Linda, I know I heard from the other nurses that you like to have your head of the bed elevated as high as possible when we're doing the trach care. I'm gonna start out with the trach suctioning, and then I'll be doing your trach care. Is that okay? She gives me a thumbs up, so I know that's okay. I'm gonna raise the bed to my level and raise the head of the bed. I'm looking at my oxygen saturation. My PCAT already got the blood pressure and heart rate, so I know the blood pressure's 120/70, and I know her heart rate's running, as I can see with the oximeter up there, heart rate's running 70 to 80, and it's not alarming or anything like that. O2 sap, she is running at 98%. I'm looking here at her oxygen, and I see that she is on the trach color, and she's at 35%, and that's set at 12 liters on my Christmas tree. Next thing I'm gonna be doing is checking my suction here. I'm gonna turn it to 80 to 120. I'm gonna put my finger on the suction thing, and it's sucking. So I know that's working and everything's going fine. I've provided privacy for her and stuff like that. Next thing I'm gonna do is go ahead and do my respiratory and cardiac assessment. So I'm gonna come in with my stethoscope. I've got gloves on at this point, and I'm gonna be doing the ape-to-man, listening through here. I got all my valves. Next, I'm going to start up here, kind of listening up around the bronchial airway, coming down bronchiovesicular, down, coming on down, and I'm going to be getting vesicular and vesicular, okay? I hear a lot of wheezes in there, so I know I need to suction her. So Linda, I'm gonna have to suction you because I can hear those wheezes. So I'm taking off my old gloves. I don't have to hyperventilate her because what was my O2 sat? 98%. Okay. This is my sterile saline solution. This is going to be in there to flush out my catheter, and I'll show you in a minute. But I just opened this bottle, so the first thing I'm going to do, I will be opening this bottle, is putting the date and my initials on it, okay? Reason why you do this, because it should be discarded after 72 hours. I always want to hold it like this, so automatically gives me the date and the initials. Okay, so I'm going to start my sterile fill. I'm staying close to my patient. Do I want to, can I reach across from this, guys? Okay. First thing, I'm going to reach in there and pinch out my gloves. I'm going to come to the end of the table. And set them up like that. Okay. Next thing, I can pop in here and pull this out, my little cup. Okay, I can reach in, I can set it right like that, which I'm going to set it right like that. I'm going to come across, grab my solution, open it up, pour about 100 mLs into that little cup, and clear it away from my table, okay? So my gloves are there. I've got my tubing ready to go, close to my patient. I'm going to come over here. I can reach inside. Notice how I stepped away from my table there. Okay, I'm not gonna mess with that because I'm not gonna be suctioning her with my wrist. I don't like these gloves. You guys who have bigger hands, make sure you get the glove size that you used earlier in this. Because I've got small hands, and look how small these are on me. Okay? Coming over here, reaching in, both hands are sterile. I'm going to reach in here and grab my suction catheter. Both hands are still sterile, but I want to show you something, guys. Look at how flimsy this is, okay? You want to keep a hold of this. You really want to keep a hold of this catheter. So now, I'm coming over here. This hand is no longer sterile. And if you look at my catheter, there's my little container, or flange on here, where I can do the intermittent suction, okay? Once I cover this hole, that turns the suction on. So, do I wanna have it covered before I go in? No. First thing I always do is I go ahead and suck up a little bit of the normal saline just to make sure it's working, okay? Then I'm gonna come back to my patient here. Remember, this is my dirty hand now. Linda, I'm gonna remove this and I'm getting ready to go in and suction you, okay? So on the count of 3, I'm gonna go in. 1, 2, 3, and she starts gurgling, no suction on. Go on down, and then I'm gonna start sucking and twirling at the same time. Out, hold it up, that goes back on, come over here, and clean my tubing. How long am I gonna wait before I can go back in? 1 to 3 minutes. Give her 1 to 3 minutes. I'm looking at her oxygen level. Her oxygen level went down 94% when I was going in with the suction, and now she's back up to 98%. So, you know we're doing fine there. Again, hold it like this. Remove this. Linda, I'm going back down one more time. No suction. Go in. Hit the back of her neck, or you'll feel it. Come out a little bit and start suctioning, intermittent. Come out. Clean my tubing. Okay? So now I'm done. So I'm gonna wrap this all up. Still looking at my oxygen level into my glove. Dispose of it. I'm gonna pass this around so you guys can see what it looks like. I am not wearing those gloves for trach care. I'm gonna discard everything and throw it in the trash. I have a trash can here. This is all, Gracie, this is all step